Welcome to Healthy Hawaii, where we talk to medical experts and a variety of different fields to learn more about our health and healthcare options here in Hawaii.
Hi, welcome to another edition of Healthy Hawaii. My name is Thaddeus Pham, and I'm with the Hawaii State Department of Health. Tonight we're going to talk about hepatitis and its impacts on our communities in Hawaii. So thanks for joining us, and I hope you enjoy. So we're going to talk about the ABCs of hepatitis, elementary hepatitis. And really, I'll cover it basically. So the ABCs of hepatitis, we'll look in what direction we're going. So we're going to see what it is, how you get it, how you not get it, right, from prevention, what to do if you have it, and maybe some action steps that we can do within our own community. So sometimes we have presentations that give you a lot of information, but maybe don't help you translate it into what you would want to do or what you can do. So we're going to talk a lot. So what is happening? I like to bring it down to our community in Hawaii. So in Hawaii, we have the highest rate of liver cancer in the country, in the entire United States. And the leading cause in Hawaii is hepatitis B and C. So even though I can talk to you about hepatitis, it really does impact our communities. And that's why I'm here today to talk about that. So first of all, I know it's late in the day, we've all had work, so I'm going to have everyone just stretch a little bit, so raise your left hand really high if you can. Everyone knows where their left hand is, right? Okay, good. Okay, stretch. Okay, now stretch your right hand really high. It's kind of a yoga thing. Now bring that right hand just onto your rib cage right there and say hello to your liver. This is your lovely liver. Hopefully he or she is as shiny as this one. This is what it looks like. Your liver is relevant because hepatitis affects your liver, right? The liver is an organ in your body. It can regenerate. So if you treat it well, or even if you don't treat it well, if you take care of it later on, there is possibilities of it healing itself. Not always, but there is that chance. And it does over 500 vital functions, which I'm going to read to you right now. Just kidding, right? But what does it do? Basically, the liver manages everything that goes to your body. So if we look at this, everything that you eat, everything you breathe, everything you drink, everything you put on your skin to keep you looking as young as I do, all of that is processed through your liver and routed where it needs to go, right? So it's a really important organ, and it has a vital function in your body, many vital functions. So what is hepatitis? If you were like me and you wanted to avoid having to speak a language in high school, you would take Latin, which is what I took. So hepatitis, hepa is liver, and itis is inflammation, right? So hepatitis is inflammation of the liver. Tonsillitis, inflammation of the tonsils. Elephantitis, inflammation of your elephant. Ta-da-ta, right? I always have to throw that joke in there. I can't not say that joke. Anyway, so hepatitis can be caused by many things. It can be caused by alcohol, as you can see, medications, other toxins, but we're going to focus on viral hepatitis. So when we talk about the ABCs of hepatitis, we're talking about hepatitis A, hepatitis B, and hepatitis C, the viruses. And one thing I want to make clear is that there's chronic versus acute. So it could be long-term or it can be short-term, basically, if you think of it that way. And what we hope is that if you're exposed to it, it will not become long-term, because long-term means that you have a lot of other issues you're going to have to deal with, yeah? Any questions so far? Right. So somehow getting fecal matter in your mouth. And when I present this to people, many different communities, everyone reacts usually with like, oh, that would never happen to me. How could that possibly happen? Well, this is a big foodborne virus. So usually when they talk about if you go to a restaurant, right, you go to the bathroom and you see that sign that says all employees must wash hands before they return. This is one of the reasons why. Because if they don't wash your hands and they prepare your food, suddenly you're going to have fecal matter in your mouth somehow. Right? So I bring this up only just so you know this compared to B and C, which are the big ones, as I showed before. It is preventable in many ways, washing hands, but also there's a vaccine for it. So you can easily prevent this by getting the vaccine. This is just some basic information about it. And something I like to remind people when I do a talk is there's technical information like this, which you can have a copy of, and there's more of the gist things. So you don't necessarily need to know that 21,000 new infections happen in the US, but you do know that Hep A is spread fecal-oral. So just learn the gist of it, and that'll be enough. So we'll have some gist points throughout the talk as well. So B is for baby, booty, and blood. Baby, booty, blood, basically perinatal for baby, right? Booty is sex, sexual transmission, and blood is blood-to-blood transmission. So these are pretty much the same ways that we can contract HIV. So if you remember HIV and how it spread, you can remember how Hep B is spread. And you can remember also that Hep B is 100 times more infectious than HIV. And Hep B can actually live in the environment, whereas HIV cannot. So in Hawaii, there's lots of these transmission routes, but the biggest source of transmission in Hawaii is from mother to child, because Hep B is really high in Asia and the Pacific Island, and I'll talk a little bit more about that. So I think one of the greatest things about Hawaii is that we're so diverse and we're so open to diversity and just really embracing that. I think the local culture is a mixture of many cultures coming together. I think we also have to remember to protect these cultures and make sure that if they are at risk for Hep B, that we can make sure that they stay healthy as well, because they are part of our community. Hep B is vaccine preventable, so that's the great news about that. You can prevent it easily with 3 shots over 6 months, then you're PAL for life. You're covered, yeah? These are some basic statistics, but again, we want to look at Hep B acute versus chronic, right? You can have Hep B, you can have acute or short term, and then your body resolves it. Or if you're exposed to Hep B and it becomes chronic or long term, you have it for the rest of your life. So currently there is no cure for Hep B if it becomes chronic, yeah? And this is the most interesting thing here. If you're exposed to Hep B, the younger you're exposed to Hep B, the higher the chances you have of it becoming chronic. So if you're exposed to Hep B as an infant, it's 90% chance that you're going to have lifelong hepatitis B. If you're exposed to it as an adult, the chances are much lower, yeah? So that's why the perinatal risk is really something to consider. And we're doing a lot of efforts in Hawaii to keep the keiki who are being born now safe. But it's the keiki who are already born, the older generations who perhaps didn't have access to this, that might have chronic Hep B. And in and of itself, chronic hepatitis B can cause liver cancer. So one of the things that leads to the outcome is liver cancer, liver cirrhosis, and possibly liver transplants. Okay, so B was for baby blood. Very good, excellent. So I bring this back because that's a technical stuff, but this is the gist stuff, right? So again, we have the highest rate of liver cancer in the country, and the leading cause is hepatitis B and C. And I want to address why. So with Hep B, like I said, it's vaccine preventable, but there's no cure for it. So if it becomes chronic, you can't cure it. And it's a leading cause of liver transplant in Hawaii and in the US now. Hep C is actually kind of equal to it now. So Hep C and Hep B are the leading causes of liver transplants in Hawaii. And it's really high in Asia and the Pacific Islands. So this is the CDC's map. Anything in red or yellow is considered intermediate to high prevalence of Hep B. So all of Asia, Pacific Islands, Africa, and then Native American communities up north over there, they really have high risk for having Hep B just by being born. So these communities, if they're born there, we want to ensure that they're taken care of and that they know that they have Hep B. So we can screen them, vaccinate as appropriate, or provide treatment for them, yeah? This is something that I created because they never represent Pacific Island, and as we know in Hawaii, these are a big part of our communities. So anything in that red or yellow was over 2%. So anything over 2% they consider intermediate to high risk. If we look, Tonga is 10%. Federated States of Micronesia is 10%. Even Hawaii itself, at the last data that we got, is 1 to 3%. So if we are our own country, we would be considered an intermediate to high risk country, yeah? So that's why we really need to ensure that people in our communities, especially if they're born in Asia Pacific Island, know about Hep B and get tested, get vaccinated, and get treated if they need it, yeah? So who is at risk for Hep B then? Just to sum it up, really it's our families, our communities, and ourselves, to bring it back to that philosophy of taking care of our own communities. So Asians, Pacific Islanders, especially if they're born outside the US, really high risk. They found that nationally 1 out of 10 Asian Americans probably have Hep B, compared to 1 out of 1,000 in the general population. So 1 out of 10 people who are Asian or Pacific Islander also could have Hep B, and especially if they're foreign born, like I said, born outside the US. This is really startling for me. I looked at the local cancer data. So this is from 2010, the Cancer Institute, and one of the leading causes of cancer death now among Native Hawaiian, Filipino, and Chinese men in Hawaii is liver cancer. So I can talk a lot about hepatitis, but it really is impacting people we know and love, especially as they get older and the chronic disease starts to take its toll, yeah? This is just taking a look at some of the census data, and I know it's a little late in the day for math, but if I were to do some calculations for you, then that national estimate, 1 out of 10 public Pacific Islanders, Native Hawaiians, or Asian Americans, based on that census data, that means 68,000 people in Hawaii could have Hep B, if we were going to extrapolate that data. That 1 to 3%, which is the Department of Health, that means up to 40,000 people in Hawaii could have Hep B. So these are huge numbers, but these are the amount of reported cases to Department of Health in 2010, 491. So we know 491 for sure have Hep B, but there could be 40,000 people who are living with it and not knowing about it. So, really emphasizes how much work we have to do in just talking about it. So you can do what I do. You can put it in a microphone and talk about it. You can talk to people in your communities, but really talking about it, raising awareness is a huge part of what we can do. And I'll talk about that more later. I'll move on to Hep C, but any more questions about baby booty and blood? You guys got it down? Okay, very good, class. You guys are very attentive. I like this. Okay. So Hep C, it's really, C has its own acronym, its own special thing. But first I'll talk a little bit about some of the numbers. And this is the big one for us is 70. So 3 out of 4 people who are exposed to Hep C will become chronic. Right? And chronic is the bad one. Chronic is the long term. It could take 20 or 30 years and suddenly you have liver cancer, cirrhosis, other issues. Yeah. And if you have Hep C, I was talking with Dr. Raj about this earlier, there's a new study that shows that your mortality, the chances of you dying, increase significantly just by having Hep C and not necessarily because of the liver. So they found that just by having Hep C, your chances of dying increase from other issues too, because it's all this other stuff to you. Yeah. If resolved, you don't get immunity, and so there's no vaccine for this. So whereas Hep A and Hep B have vaccines, Hep C there is no vaccine. Yeah. But whereas Hep B there's no cure, C there is a cure now. It doesn't work for everyone, but there is a cure, and there's more and better drugs coming out to help people cure it. So you can think of C as for cure if you want, or also C is for cooker. And does anyone know what kind of cooker I'm talking about? I think you know, Tina. I think Sarah knows. So it's not slow cooker or rice cooker. I'll give you guys that one, right? So it's from drug use, right? So cooker is part of the paraphernalia that drug users, especially injection drug users, use when they shoot up, when they inject themselves with drugs. And so this is really impacting that community. And I call it a community because they have their own culture, their own ways of doing things. And because, especially in Hawaii, we do have a lot of people who inject drugs, yeah? I mean, this is one of the groups that won't necessarily have a voice to advocate, but I think we want to, even though they're making choices that we might not necessarily agree with, I think they should stay healthy too, because they have family members, they have children. If you're keeping them safe and healthy, you're keeping their children and their wives and their husbands safe and healthy too. So C, not just injection drugs, not just needles, hormones, steroids, insulin, all these other things that can pierce the skin, if you share it or you share any of those paraphernalia, could expose you to Hep C. There's some sexual transmission. There's also mother-child. These aren't as high, but I just put it on there for your information. So technical stuff, not necessarily the main message. Tattoos, really big in Hawaii as well. And the big message here, if you guys know people who are going to get tattoos, is getting tattoos outside of a shop, outside of a professional setting, puts you at 2 to 3 times higher risk. So primarily, if you get it in the shop, you ask questions, you really, practice self-advocacy. Ask your tattooist if you guys have people you know who are going to get a tattoo, the younger generation, like me. It's really part of the culture. And then Pacific Island culture, it's really part of the culture. So being aware of this. I think an important thing, again, to be really respectful of community. So there are cultures where tapping, with bone is part of the culture, where they have really beautiful, Polynesian tattoos. So I think we have to respect that, but I think we also have to be able to give people information so they can make a choice too. So they know if they do this kind of tattoo, then they could put themselves at risk for Hep C. And there are practitioners of the more traditional tattooing that kind of make a little concession, and they'll work with a steel needle instead of bone or something like that. So there are choices you can make. one documented case of MMA fighters getting Hep C, and that's huge. That's becoming a huge sport, especially in Hawaii as well. So this is a great example of a community taking care of itself, though, because the MMA community pretty much decided that before the guys could meet with each other in the ring, that they would have to test themselves. So again, communities empowering themselves and making sure that they take care of their own community members. I think it's a great example. And there's some other low and unknown risks. So pretty much any place you can share blood-to-blood contact would be at risk. So if for people who snort drugs, but also personal items, they have found it sometimes in nail salons. So if they reuse clippers and then they pierce your skin, and then someone else comes in and they pierce your skin with a nail clipper. So sometimes they'll say just to bring your own kit to a nail salon, things like that. Yeah. So there are healthcare things to be considered. I just want to share with you that, we think of Hep C as only certain communities because I've been talking about a lot about drugs, but I don't know if you guys read about any of these cases where Hep C was spread just by going to a clinic. So in Vegas in 2008, there was an endoscopy center where you just go in, do an outpatient thing, and you would leave that day, right? What they were doing is they didn't reuse any needles, but they had a multi-dose vial of propofol, and they would draw from that, inject a patient or whatever would be needed, and they were like, oh, they need more. So they'd use that same syringe and draw from the same vial again, and then give it to them. And then someone else would come along with their own needle, but they would use from the same vial, right? So as you can see, about 50,000 people were possibly exposed. At least 9 people got Hep C from this. So really, it's not just that. Yeah, it's really reminding you again, patient advocacy, really making sure that when you go to your doctor or talk to your provider, that you ask certain questions, that you advocate for yourself. I think the message with hepatitis is really just using your voice for yourself and for your community to talk about things and to ask questions. So again, it is mostly people who inject drugs or who use some kind of injectable who are exposed to Hep C. And like I mentioned before, Hep B is 100 times more infectious than HIV, and Hep C is 100 times more infectious than HIV. Because we all know about HIV, but we don't hear so much about hepatitis, right? So really, this is getting to such the point that now, as of 2007, I don't know if you guys can see it, but there's more people dying who have hepatitis and HIV in the country now. And at this point, more people are actually passing away from hepatitis than from HIV. So we did a really good job with HIV. We raised a lot of awareness, but now we kind of, at the same time, didn't talk about hepatitis, and that kind of came up a little bit more. So this is the chance. This is kind of like HIV's time where we could really advocate and talk about hepatitis. So that's basically how you get hepatitis. Again, I always bring it back to our main message, which is we have the highest rate of liver cancer, and the leading cause is Hep B and C. So again, it does impact people in our state. Yeah. And what needs to be done? This is one of those GIST slides like I was mentioning. The basic messages: get tested, get vaccinated, get treated if you need it, and then get educated. Yeah. So how do you check? So the first one, get tested. How do you check for hepatitis? Really simple. For Hep B, if you think you were exposed to it, either through blood, booty, or if you're born in Asia Pacific Island, right? Then you just need to get tested for Hep B one time. I think a lot of the doctors call it one and done, I think is one of the doctors says. So what you do is you get this test for Hep B, and there'll be a test for immunity to see if you're already protected, and a test to see if you have it, a test for infection. So if you have it, then you know you should go to your doctor and start checking on your liver, seeing if you're eligible for treatment. If you're protected, then you're all POW, right? You don't have to worry about it. And if you're not protected and you don't have it, then you can get vaccinated, and then you're POW. So just really one and done. You just get tested one time for Hep B if you're at risk, and then you know you're okay. A little caveat that I put here is some people were infected before they got vaccinated. So if you were at risk for Hep B, let's say my uncles were born in Vietnam, and then they got vaccinated when they came here, because that's what immigration requires, right? Immigration doesn't require that you test for Hep B, they just require that you get the shots. So you could have already had it, but at least you have the shots for some reason. So he thought he was okay, and then actually my uncle passed away from Hep B because he didn't address it until it was too late. And again, there's a whole host of factors. There's cultural stigma. That, older Asian men typically they're not going to talk about certain things that relate to health, at least in the Vietnamese community and some other communities. So unfortunately, he passed away from that. So this is a big message. If you're born in Asia Pacific Island, even if you got the vaccine, get that one-time test, and then you're okay. Yeah, because you can address it. This is the CDC recommendations. I'm not going to read them all to you, but I put it there for your details. Again, two of the biggest ones are people born in those countries, Asia, Pacific Islands, Africa, and then the northern part of North America. Yeah. For Hep C, it's really simple. We have the lovely Sarah in the back there. If everyone can just turn and see Sarah. She works with the Hawaii Island HIV/AIDS Foundation, HIHAF. And so what they do is they actually provide free Hep C testing. The nice thing is now it's a rapid test. So like HIV, all you have to do now is prick your finger, and then in 20 minutes you get your result for the Hep C antibody test. Really simple, especially if you're exposed to blood, all those things I mentioned before. If you're antibody positive, then you just you make sure that you go to your doctor, get the follow-up test to see if you actually have an infection, and then you can either make one decision or another. Either get treatment or get monitoring if you need it, or practice prevention, not exposure to blood, so you can stay negative for Hep C. Any questions about that so far? Okay, good. You guys are soaking it all in. I like this. You're absorbing everything. So this is the CDC recommendations on who should get tested. So if you ever injected drugs, even one time, you should get tested. And then this one is the thing that's been coming up a lot during this talk. And I'll make it a little bit bigger for you. So it's pretty much anyone born between 1945 and 1965. And this is why. This came out in August of last year. The CDC saw such a huge burden among baby boomers that they had to make a recommendation. So baby boomers, I don't know what you guys did back then in the day, but we just want to make sure you're okay now, right? So if you're born 1945 to 1965, a host of reasons, not only, like I said, not only drugs, but screening for blood only really began in 92, like hardcore screening for blood, and that was instigated by HIV/AIDS because people were suddenly concerned about the safety of the blood that they were getting, right? So before 92, there was no major screening of blood, especially for Hep C. They didn't even know it was Hep C back then. They called it non-A, non-B hepatitis. So there was no screening. So a lot of people could have been exposed through medical procedures, through getting, there used to be, I talk a lot to veterans. They said they used to line up in a big line and a guy would just go down and just give them vaccines with the same little gun thing, one after the other in the arm, right? So, you could have gotten Hep C that way. You don't know. So if you're born in this time, they say get a one-time test, one and done, right? 1 out of 33 baby boomers have chronic Hep C. And of all the people in the U.S. who have Hep C, 75% of them are baby boomers. And this is not just nationally. I looked at data for Department of Health. The majority of people now who have Hep C that we know of are baby boomers. So really, it does impact this community, the community of baby boomers. Most of them don't know they have it, and this is going to become a big issue later on because, like I said, 20 or 30 years, right, takes for Hep C to kind of do its thing before you notice anything, before you notice symptoms. So they're estimating in the next 10 years, primary care providers, hospitals, Corona Hospital, are going to see a lot more baby boomers coming in suddenly with pain right here. Because a lot of them who have Hep C are starting to start noticing things symptomatically, and there's going to be a huge upswing in the amount of people who are coming in for liver-related issues. So this is really important. That's why we want to really stress baby boomers get tested one time for Hep C, because then if you know you don't have it, you're fine, and you're not exposed to anything else, then you're okay. If you do have it, you can go to your doctor. They can monitor that liver before it becomes something worse. Yeah, and like I said, C is for cure. So there's more medications that will help cure it now too. Now we know how you get it, how you test for it, how do you prevent it, right? How do you not get it? Well, for Hep A and B, get the vaccine. It's really easy. It's very safe, very effective. It's 2 shots for A, 3 shots for B over 6 months, then you're pal for life, right? And like you mentioned earlier, even if you don't have antibodies show up later on, you might lose the antibodies, but you still should have the protection, unless you have some kind of immune compromised thing like HIV, or if you're going like on chemo, sometimes they'll recommend that you get tested for Hep B because they want to make sure. These are people who should get tested for, get the Hep A vaccine, so it's just technical information, and who should get the Hep B vaccine. The interesting thing is the CDC spends all this money and all this time gathering people together saying who should be vaccinated for Hep B, and they made that huge list I just showed you, right? Then they said, oh, and then also anyone who goes to a clinic, who's in drug treatment, correction, so anyone who's been in the prison system, who's an injection drug user, or who's a men who have sex with other men, so gay men. Then they said, well, and then anyone who's unvaccinated, who's an adult. And then they said, well, anyone who asks, really. So pretty much everyone should get, and this is a CDC, so you can see how much they're doing for us. But they made that recommendation. This is an important one, and that's huge, especially in Hawaii, because we have a really high rate of diabetes. And they say all diabetics should be vaccinated because they have a higher risk, 2 times, of getting Hep B. And the reason is because there's apparently a lot of sharing of different, when they do the glucometer, there's that finger prick thing, and they don't always practice the best safety for that. So they've been seeing a lot more Hep B among diabetics. And diabetics, lots of issues, so you're adding diabetes to fatty liver, possibly to hepatitis, so then you have all this stuff going on in your body. So really, diabetics should really get vaccinated as well. So no need for pre or post vaccination testing. So you don't have, they say if you're at risk for it, if you're one of these things or the ones before, you don't have to get tested before you get vaccinated. They say, you know what, if you think you should get the Hep B vaccine, just get it first, just to make sure that you have some protection just in case you don't have Hep B. So how do you prevent hepatitis? Well, wash your hands, remember A, reduce your exposure to blood, and then just get the vaccination, really easy. So really simple ways to stay Hep-free, yeah? So you did all this stuff, you know how you get it, you know how you don't get it, but what happens if you do find out you have chronic hepatitis? Well, there are some easy things that you can do. The biggest message, the gist message is, if needed, get treated. So not everyone will need treatment for hepatitis. The important thing is to get to a doctor so they can monitor the liver. Remember, it takes a while. So if you've just been exposed to hepatitis and you just got it, you have a while before it'll start to do damage. So you don't have to get treated right away. You can monitor the liver. You could wait till the new meds that come out next year that are more effective, safer, less side effects. You can wait. But really getting to the doctor is an important next step if you find out you have hepatitis, so they can make sure your liver is okay. And the other important one, I think, here is to get your family and loved ones tested. So with hepatitis B and C, there's 2 different kind of things to remember, right? B, there's no cure. So the whole point of going to a doctor for Hep B is that you really want to suppress the virus. So they're going to monitor the liver and try to keep the virus down so it doesn't do as much damage to the liver, yeah? So that's what they do for Hep B. For Hep C, there is a cure. There's a lot of technical information on here, but the cure is called the sustained virologic response. This is the first curable virus ever that they found. And it doesn't work for everyone. I'll talk a little bit about that, but it is increasingly work for more people. The standard of care used to be 6 to 12 months. So you were 6 to 12 months on this medication, and the effectiveness was around 40 to 80%, depending on many factors, yeah? Including how old you are. So the older you are when you start treatment, the less effective it might be. It works better for women than men. It works better for certain races. Other things like how much BMI, how big you are. Because of fatty liver, if you're diabetic, all these other things can impact how well the treatment will work for you. So a lot of factors come into play. And the big thing right now with the treatment is that you need a lot of self-care too. So not just medical care, but really support from your family, from friends, from loved ones, because it can be a really hard treatment to go through. And these are a great website, so I have some free stuff back there for Hep Free Hawaii. It's a local coalition, like I said, that really consolidates all the information about hepatitis, especially as it pertains to our communities. And these are some resources for you guys. So I'm on Oahu, so I'm right there. But on the Big Island with Department of Health, there's Peter Silva. He's really awesome. He's over on Hilo side. And then Sarah representing High Half. It's right here. They do the free Hep C testing. And that's the end. You made it, class. So any other questions?